Diarrhea is not something anybody should joke about, both as an adult or a child. And one thing about diarrhea is that it is very common in children. Diarrhea is when someone passes frequent loose stool and is very watery. Diarrhea is very common in children 0 to 5 years, and it can become very dangerous if not managed quickly. How do we get diarrhea? By eating food or drinking water that is not clean, putting dirty toys or objects in your mouth. You didn't wash your hand after using the toilet or changing diaper. It can also come from infection from germs like bacteria, virus, or parasite. In diarrhea, the main danger here is dehydration. The individual loses water and salt very fast, and if this thing is not replaced, the person can become seriously ill. In the process of losing this water, they lose what we call electrolytes. Normally, these electrolytes in the body are supposed to be stable. They are supposed to be within normal range, but when they lose these electrolytes, they become disarranged. They will no longer be the same, and it will no longer perform its work in the body. It is this loss of iron that mostly causes death in diarrhea. As parents, watch out for the following, especially if your child is having diarrhea. Sunken eyes. Are the eyes inside? Are the eyes dry? Are the lips also dry? Is there little or no urine? Is this child very weak, restless, or unusually, feeling sleepy? Is there dry mouth and dry tongue? Is it that this child is feeling very tasty or cannot drink? Sometimes these symptoms also appear to adults. When you notice this thing, immediately you start giving what we call ORS. Say it again, ORS. ORS simply means oral rehydration therapy, and it is used to replace the lost salt, water, and electrolytes immediately. Also, if this child is young and breastfeeding, continue feeding this baby with breast milk because it will help replace the electrolytes and the fluid immediately. The essence of giving the child ORS is to replace the fluid and electrolyte, because that is what can kill the individual fast, especially if your house is far from the hospital. This is what you do. That is why it is very necessary for you to know the warning signs of dehydration or diarrhea so that you rush the child to the hospital immediately.